Next drug is very much used antibiotic, vancomycin. Vancomycin is a cell wall inhibitor, synthesis inhibitor by binding the D-ala part of the cell wall structure. And how to resist vancomycin? Just enterococci, like enterococci, vancomycin resistant enterococci, they just modify their cell wall structure from D-ala to D-lac. They change their target of the vancomycin to be enteromycin resistant enterococci. So the side effects are very much interesting, that they can cause nephrotoxic, they can cause ototoxic. They are nephrotoxic, ototoxic, and they also cause thrombophlebitis or thrombophlebitis, and also they can cause flushing, which is IgE independent red man syndrome. And in this red man syndrome, there is IgE independent mast cell activation, which can release histamine, so we can use antihistamine prior to use vancomycin. So the symptoms are flushing, redness, pruritus when rapid infusion. So whenever we use rapid infuse vancomycin, it can lead to Redman syndrome. And also it can cause DRESS syndrome, which is diffuse redness, eosinophilic, systemic symptoms, lymphadenopathy, redness, and fever. So side effects are very much important. The next is vancomycin is not for beta lactamase releasing bacteria, so they are used for gram positive bacteria only, which are very much serious and very much drug resistant. So those are Staphylococcus dermitis, and we can use in MRSA, obviously Staph aureus. We can use in enterococci, from where the resistance originated, and we give in Clostridium difficile as orally, so have minimal systemic absorption. So for Clostridium difficile, it's bacteriostatic, and the rest of them is the bactericidal effect. So this is vancomycin. The next in carbapenems. So carbapenems or monobactam, they are used when all the things are failed. They are doripenem, imipenem, meropenem, and ertapenems, and they are penicillin derivatives. So the side effect include penicillin allergy. So mechanism is they are obviously they are penicillin derivative, so they are cell wall synthesis inhibitor. So how to resist this? The Klebsiella and E. coli E. coli, they just produces enzyme which dissolve this, so they produce carbapenemase enzyme to dissolve this antibiotic. So the side effects are pretty much significant. That's why we limit their use and reserve it for only life-threatening infection. So the side effects are GIT, distress, rash, and sears. So clinical uses are the imipenem. Imipenem is a very much broad spectrum. It covers gram-positive, negative, and anaerobes. And imipen as a clinical effects. Clinical effect is when all the other drugs are failed, and whenever there is 10 of 10 life-threatening condition, then we use carbapenems. So imipenem is a broad spectrum, and we can always add xylostatin, which is actually the renal dihydropeptidase inhibitor, and we always add xylostatin with imipenem to increase its bioavailability. And imipenem is a broad spectrum, extended spectrum beta lactamase resistant type of carbapenem. And then we have the meropenem, which has a pretty much advantage that it decreases the risk of seizures, so no need of colistatin. And the next is the monobactam. So if a person is sensitive to this penicillin derivative, penicillin allergic, or if the person is renal failure, then we use monobactam, and it is used for treating only gram negative rods. And that's all. This is all the antibiotic.